Hello, welcome back to T Space. Are you looking forward to a band nursing position and you want to ace the interview process? Then this is the video for you. Do not skip. And on this video, I'll be telling you the tips and tricks and also some likely band 6 nurse interview questions they are likely to come across during your interview. Do not go anywhere. Let us get right into the video. In order to ace your Bansis interview, focus on showcasing your leadership skills and clinical knowledge to make good clinical decisions and also manage staff properly. For this interview question, I'll be dividing it into four different segments. So the first segment is the basic. The basic consists of the introduction part of the interview where you introduce yourself and they ask you little questions about yourself or your experiences. Then the second part of the interview is going to be the scenario-based questions. For the scenario-based question, they give you examples, give you scenarios of what has happened, and they need you to answer those questions. So in answering scenario-based question, you need to give examples and also use the SMART techniques in answering scenario-based question. Then the third part of it is going to be the trust or the setting-based question. So is it an NHS? Is it a care home? What are the trust values? What is the hospital known for? What are the CQC? So they are likely going to ask questions around their values, and it's very good for you to know their values. And also for this setting, with the knowledge of the CCs of 6Cs of nursing, you should be able to answer those questions. Then the third part, the last part of the interview process, they will be asking you questions. Do not go for any interview without asking the interviewer any questions. In this part, you can ask them question of what the culture is all about, ask them more about the values. You can also ask them about growth, career development. How do they support staff members? Just ask them questions. Do not leave your interview without asking them any questions. Second question is going to be, what makes you the best for this job? So for this particular question, you're going to capitalize on your strengths and also show how confident you are. Do not underestimate yourself. Make very good use of your experiences. So tell them why you
Why are you
want
the best
them.
candidate? I see myself as a leader and mentor, someone who's able to stand for others. I'm compassionate, caring, committed to my responsibilities, a valuable team member, and a great patient advocate.
Do not forget to click the subscribe button and turn on your notification bell. Also, please like and comment if this is helpful to you. Thank you very much. The next question is going to be, what will you do when you have a colleague or staff member that underperforms? What will you do?
Communicate with member staff to find exactly what the problem is and tackle accordingly. Check if they require more training. Support staff and assign a shift schedule. Engage in debrief after shift. Provide a mentor or preceptor for the staff. And if all this effort has proved abortive, then you can escalate to the senior or to the manager of the ward to
Then the next question is, how will you respond if you disagree with other member of the multidisciplinary team? Let's say the doctors, the physiotherapist, or any other member of the multidisciplinary team. How would you respond?
The aim is to maintain professionalism and trust, communicate calmly, tackle concerns professionally, ensure patient safety at all times, escalate to the ward manager or to the senior team if you're not able to resolve the concerns at hand.
Another example of a scenario-based question is, two members of staff, maybe a nurse and HCA, are having disagreement in the presence of patient, or they might also ask you a question, a patient and a staff member, or a patient relative and a staff member, they are having conflict. How will you resolve it as the band 6 nurse on duty?
Remember the NMC code to always promote professionalism and trust. Speak with them separately in a private and quiet place. Do not take side and be professional. Tackle concerns accordingly. Give break to member of staff if possible and if you're able to accommodate it. Ensure patient safety. Ensure they are calm and safe to work, and escalate to the manager if you're not able to resolve it.
Facing challenges during band 6 interview is a very common thing. It comes with nerves, tough questions, but in all you need to make sure you're comfortable, you need to make sure you're relaxed, and also take charge of the interview. Always be ahead of the interviewer, in the sense that when they ask you questions, say something. There's no room for I don't know. It is better you say something that is a bit off point than not to say anything at all. At least it shows that you are willing to learn and you're ready for the job. Another question is, as a band six in charge of the shift, another unit is short staff and you've got the adequate number of staff, sometimes maybe a little bit less. How would you prioritize your staff strength to be able to send a member of staff to assist the other unit without leaving your unit short? How would you do that? How would you come up with that decision?
A band-6 nurse is a decision maker. You need to ensure patient safety. Do not send your most experienced staff or new staff on the ward. Ensure that whoever you are sending is supported and do not also miss their break. Inform the manager of the changes and document or do a date is depending on the hospital policies. The main thing is to make sure that you are not short-staffed yourself and you can support.
Congratulations! I know that you're gonna ace this interview, so go and smash it. Put everything I've said in this interview, the strategies, the tips, and the tricks, and by the end of the day, you'll be glad you did come across this video. If this video has been helpful to you and you want to see more of my videos, please do not forget to click on the subscribe button, turn on your notification bell, and also like and comment. If you'd like to know how I transition from a band 5 to a band 7 nurse, I'll be putting the video right here, somewhere for you to go watch that video in order to encourage you. Thank you very much, and until next time, don't forget that this space is a safe space to be. Bye.